Welcome to our explainer. Today, we're zeroing in on a really important topic for pharmacists: how to counsel patients who show up at your counter with the sudden and, let's face it, pretty scary symptoms of Bell's palsy. We're going to give you the key points you need to know.
All right, let's kick things off with the single most powerful thing you can tell a patient. Up to 85% of people with Bell's palsy get completely better on their own, even without any treatment. Seriously, leading with that can just instantly bring down their anxiety level. It's a huge relief to hear.
So here's what we've got on tap. We're going to quickly cover what Bell's palsy actually is, then talk about the red flags you've got to watch out for. After that, it's the treatment playbook, some special cases, and we'll wrap up with a handy little checklist for you to use.
Okay, section 1. Let's really dig in here. I mean, to be great at counseling, you've got to have a rock-solid idea of what Bell's palsy is and what it isn't.
So what are we really talking about? At its heart, it's all about inflammation. The facial nerve, which is the seventh cranial nerve, gets all swollen and angry inside this tight, bony canal in the skull. And that pressure is exactly why the symptoms pop up so suddenly. It's pretty dramatic.
So what's this gonna look like when someone walks up to you? Well, you're looking for a classic triad of symptoms. They'll almost always describe a super sudden, one-sided facial droop, and it affects the whole side of the face, both the forehead and the mouth. They might also complain about pain right behind their ear, and sometimes a weird metallic taste.
And you know, this isn't some super rare thing you'll never see. It hits about 20 people for every 100,000 each year. The takeaway here? You are definitely 100% gonna run into this in your practice. It's just a matter of when.
Now, this brings us to what might be your most crucial job as a pharmacist in this situation: knowing when it's not Bell's palsy, because that's when you have to tell them to get to a doctor like right now.
So the big question you have to ask yourself is, could this be something else? You have to run through a quick mental checklist, because your questions can be the first line of defense against missing something way more serious that's just pretending to be Bell's palsy.
Okay, here are the big ones to look out for. If your patient mentions any kind of blisters in or around their ear, you should immediately think Ramsay-Hunt syndrome. If they say they have any weakness in their arms or legs, that is a massive red flag for a stroke. And remember, Bell's palsy comes on fast. If they say the weakness has been creeping up for weeks or months, that's not Bell's palsy. That could be something else entirely, like a tumor. Think of this as your stop and refer checklist. A slow start, weakness on both sides of the face, or any other weird symptoms like numbness or weakness in their limbs, any of those mean it's time to stop counseling and start referring. They need a doctor to figure out what's really going on.
Okay, so let's say it is a clear case of Bell's palsy. Now we get to the fun part for us, the treatment strategy. This is what you'll be dispensing and counseling on.
The good news is the management is pretty straightforward. You can really boil it down to 3 key steps. Number 1, steroids. Number 2, maybe some antivirals. And number 3, and this is a big one, protecting the eye.
All right, the absolute most critical piece of the puzzle is starting oral prednisone. The standard dose is 60 milligrams a day for 5 days, and then you taper down for another 5. And you have to stress to your patient that this is a race against the clock. The sooner they start, the better. The real benefit happens when they start within that first 48 to 72 hours.
So what about adding an antiviral, like valacyclovir? Well, this is where things get a little debatable. The evidence is kind of all over the place. We know that antivirals by themselves don't really do anything, but there is some thought that for really severe cases or for patients who are immunocompromised, adding it to the steroid might give them a little extra boost. And listen, this is every bit as important as the prescription. Because the patient can't blink right, their cornea is totally exposed and can get scratched up. So you need to walk them through this. Use lubricating eye drops a lot, all day long. And at night, they have to physically tape their eyelids shut. Then during the day, wearing glasses helps protect it. This is non-negotiable.
Now, of course, one size doesn't fit all in medicine, right? So let's talk about a few special groups of patients where the usual playbook might need a few tweaks.
Okay, we've got 2 big ones here: pregnant patients and kids. For pregnant women, especially later on in the 3rd trimester, the prognosis is actually a bit worse, unfortunately. Steroids are generally thought to be safe after that 1st trimester. Now, for kids, it's a totally different story. We actually don't recommend steroids for them routinely. There's just no data showing it helps. And get this,
Over 93% of kids get better all by themselves.
Now, for breastfeeding moms, the counseling is much more straightforward, which is great. You can tell them with confidence that prednisone is considered safe. Hardly any of it gets into the breast milk. And if an antiviral is part of the plan, valacyclovir and acyclovir are the go-to choices. All right, let's bring it all home. We're going to wrap all of this up into a simple, effective checklist that you can have in your back pocket for the next time you have to have this conversation. Here it is, your 4-point plan. First, reassure. Tell them the odds are overwhelmingly in their favor for a full recovery. Second, instruct. Hammer home how important it is to start that prednisone right away and finish the whole course. Third, demonstrate. Don't just tell them, show them how to use the eye drops and tape the eye. And finally, advise. Make sure they know to call their doctor if things get worse or just don't get better. So you see, in the end, your job here goes way beyond just putting pills in a bottle. With the right information, a little reassurance, and some really practical advice, you can take a patient who is scared and confused and turn them into someone who feels empowered and confident about their own recovery. And that's a pretty amazing thing to be a part of.